that directly benefit a grant-supported project or program. In-kind contributions may be in the form of property, real property, equipment, supplies, and other expendable property, and goods and services directly benefiting and specifically identifiable to the project or program. Okay, so it sounds like a bunch of lingo here, right? So if we're looking at, I'm going to go just a little bit. Here's sort of the things that we're talking about. Things in this case means anything and everything you can possibly think of. The things that can be contributed to your project or program include people's time, maybe in the form of service performed for your program, real property, equipment, materials, supplies, facilities, services, travel, and all are part of otherwise approvable indirect costs. So anything you can kind of think of as far as the contributions that don't fall into these listed categories, right? So one thing that can never be an in-kind contribution is cash, okay? So very specific there. When we're talking about in-kind, that is not cash. So somebody cannot just give you money. That is not an in-kind. And so there's a little bit of discrepancy there because sometimes we do think about it in that way. Like if somebody wants to make a donation, we call that an in-kind contribution, but that's not actually true, okay? In-kind contributions cannot be cash. Cash is cash. So if you have somebody who is giving you cash, you need to specifically allocate it in that form and not consider that an in-kind contribution, okay? And there's another note here about real property. That's actually a legal term that has a precise meaning. Real property is land, including the buildings or improvements on it, and natural assets like soil and trees, minerals, water. So when you don't want to consider something real property unless it actually fits that legal definition, that piece of the lingo matters. And then people's contributed time comes in many guises. So a few of those might be employee release time, foregone stipends, honoraria, allowances, any of the foregone wages that somebody would, which we would call unremunerated services, and volunteer work. Okay, the rest of the items in this list are pretty self-explanatory. We will talk a little bit about the difference between equipment, materials, and supplies. All of those seem pretty straightforward until we kind of get to shake them out a little bit and what actually constitutes what, and how do we categorize those on our actual grants, and especially in our budget narrative. Okay, so the other thing that we have as far as in-kind contributions is what we consider actual contributions. Okay, so the condition that makes the provision of stuff into this kind of contribution is that the provider of that stuff is not paid for their services. The recipient of the contribution is not paying that provider for any contribution for that. A contribution is something that's given freely. So contributions, and therefore the in-kind, can come from people and organizations that participate in each one. And it might include the applicant, your organization, right? It might include things from your partner organizations. It might be your volunteers. It could potentially be service providers, or maybe it's even project participants or any other person or group. Okay, so we have a lot of different options as far as people that can contribute to our program. And that's one thing we can think about is, are we using the resources that we could potentially have, especially if they can be an in-kind contribution? Is there a way for us to work with community partners and build coalitions? Can we partner up with other organizations that may potentially be able to have an overlap to where we can do something like within the community? Is there a way for us to promote our new project or a piece of our new program, something we want to get done in the community that we need some flyers for? Can we get the school? Can we get a class maybe that I teach to help us create some flyers or infographics, things of that nature? Can we get people to give some of this in-kind contribution that we could actually then save some costs in other areas for our program? That's the best thing for us is, can we be efficient, effective, and equitable, right, in everything that we're doing? And this is a good way for us to sort of look at what we're doing. What does our budget look like? Where can we stretch that? All of us know that we're constantly under threat of losing funds for our programs. So anytime that we can sort of take a step back and look at these things and think, are there any of these pieces that we're not utilizing that we could use? Is there a way for us to be able to do that, to maybe free up some resources in another area for our program that we maybe have been spending money on in the past? Okay. And then the last thing of the in-kind is what we call value. And so we talk about the value of a contribution is the amount of money that it would cost to purchase, lease, or rent the things that are being contributed. If we're talking about real property, we're interested in what they call the fair market price, okay? So this is the price that a prudent person would pay for property, service, or other assets at a particular time under the free market conditions and the conduct of competitive business. So again, if we're going to rent a truck, it's how much does the truck cost to rent? That's pretty straightforward, right? If we're going to use a piece of land, how much would it cost us to rent that particular building or that office space or those kind of things? So this is that definition as far as value of things. But if we look at, when we talk about, again, as we're doing equipment or facilities, that's a pretty straightforward definition that I just talked about. We just look to see what it would cost to rent a truck for 2 hours. That's what we include when we're talking about what we're going to spend on that. So most of those things are fairly straightforward to find that. But when we switch and kind of talk about people's time, this is different. So if you're having to account for someone's time, the source of the person and the method of their contribution determines the method of calculating the value of their time, okay? So if people are released from their regular work, that would be how we calculate their time. But that gets sort of tricky as we talk about the cost of their wages and the fringe paid to release those employees by their employer for the time spent on to work on that particular thing. So again, if you're starting to work with partner organizations, how are you calculating that person's time, especially if you're not paying for that? This would go into your total program budget. You would show that these were in-kind contributions and how much are they actually contributing to your program, okay? Is it some sort of a substitute from their normal job? And if that method is that their employer is replacing them with a temporary help, it's actually the cost of a temporary help. So let's say, for example, a teacher is going to come, she's going to take an afternoon off. Her school allows her to take some time to volunteer, and she is going to be gone for the afternoon. Well, her students still need a teacher there, right? So they would get a substitute teacher. So if we were calculating her time, we wouldn't calculate it based on her normal wage. We would calculate it on the amount of money that the school would spend on the substitute. So it gets a little tricky as far as how do we calculate time. And if we're talking about an actual volunteer that are performing work for your project, if we're looking at the fair market value of that work performed, that's the value of their contribution. So if we're looking at, we're going to use this example of a medical provider. So let's say there's a medical provider in your community, okay? But you actually have had a really big windstorm and there's all this brush down around your building and people can't get in and out freely, and you need somebody to come and clear this brush. And this medical provider actually happens to live up in a forest type area. And so he's got some equipment and he has time on a Saturday or a Sunday, and he's going to come and clear this brush for you. Okay, so if we were going to talk about the value of his time, we wouldn't be talking about the value of his time as a medical provider, because that's not the service he was providing. What we would actually be looking at is what would it cost us to hire somebody to come clear the brush, okay? If he was showing up though to give vaccinations at a clinic for us, then we would have to think about his time as far as being a medical provider, okay? So again, it's important for us to see this kind of thing. So for instance, I always use the example that when my son was in high school, I was the treasurer for the boys basketball booster, okay? So if I'm giving my time for that, it's not my time as a professor, it would be the time that it would take somebody who was doing accounting for it to be considered what my in-kind contribution was to that as far as a volunteer goes, okay? So when you're thinking about people that are giving this time, there's a big difference, right? Medical providers, their hourly rate would be much higher than somebody who is coming to clear brush. And of course, then if we'd have to think about the equipment that we would have rented if he's providing that as well. So there'd be several pieces to this kind of contribution. So now that we've talked about that, as I mentioned before, I showed you that HHS definition of in-kind, and then I said that I had taken it from this Grant Winner's Toolkit, and this is what they talk about. An in-kind contribution to the budget of a project or program is the fair market value of contributed real property, time, equipment, materials, supplies, facilities, services, travel, and the waiver of all or otherwise approvable indirect costs. So we will talk about this idea of approvable, which we also consider allowable in just a few minutes. So if we're looking at this, that piece of it is a little, we're still not really understanding. The rest of the things, again, we are going to talk about the differences between materials and supplies and equipment and how do we do that. But eventually we're going to lump all of those things into that piece of it. Okay, and I think if we have, let's see, do we have a poll? I think we have a poll here after first one after this slide. Do we have those ready or not, Desiree?
I don't think that we have that ready. I'm sorry, Tricia.
Okay, that's fine. So I'll just throw it out there. Let's see, how about what does everybody say? You guys can just throw it in the chat. If you help out at a local food bank on the weekends, is that an in-kind contribution? Yes or no? So if you help out at a food bank on the weekends, would we consider that an in-kind contribution? Yes or no? What do you think? You guys want to answer in chat? So if you're, you normally have a job Monday through Friday, if you are giving some helping out at a local food bank on your weekend, what do we think? Yes or no? Is that in kind? Yes, that you are correct. That is in kind because you are doing something different and you are helping out. Notice I gave that word, I didn't say volunteer, right? But so if somebody says they're going to help out or they're volunteering or they're going to be there for their time, that is considered an in-kind contribution. So if you are giving your time freely, you are giving that as an in-kind contribution, okay? All right, so let's talk a little bit about cost. Again, most of us can think about cost as a pretty straightforward idea. We deal with costs every day in your job, in your home, in your family, right? You all have to deal with budgets. And especially, like I said, when you're dealing with grant budgets, costs become a bit more complex. The first thing we want to do is decide whether or not a cost is allowable. Another term for this is allocable. Okay, so allowable, allocable, both of those are interchangeable, okay? So then we have to classify it as either a direct or an indirect cost. So again, this seems straightforward. We're looking to see if this is allowable versus unallowable. And how do we decide? How do we know if a cost is allowable? So what we want to do is to actually follow the cost principles, okay? The cost principles establish general standards for the allowability of costs. That's the first thing it does. It establishes those general standards. It provides detailed guidance for us on the cost accounting treatment of whether we consider something a direct or indirect cost. And it sets forth allowability principles for selected items of cost. It's going to tell us what's allowable and what's not allowable. And finally, the applicability of a particular set of cost principles depends on the type of organization making the expenditure. So an example, a nonprofit organization that receives an award from a state recipient would be subject to the cost principles for nonprofit organizations, while the state would be subject to the cost principles not only for the state, but for local governments and for tribal governments, and maybe even for federal governments. So you basically have to think about, first of all, if we're using cost principles, what are they? Where do we find them? How do we find out if what we're doing is correct as far as how we're classifying costs? And how does that apply to us? What are you responsible for doing? So some of us might fall into this idea of thinking that we're only responsible to the people who are giving us the grant. That's not necessarily the case. And again, for those of you who have been doing this for a while, you will see that not only, let's say your grant comes from the federal government, right? One of the things that you're going to see along the way is that you're also going to be beholden to what the state holds you to, and maybe even the local, even if your grant comes from somebody else, like what you're allowed to do and what you're allowed to ask for and how you're allowed to spend that money. There may be some tweaks along the way that is not just so specific for the grant that you're given. Okay, so where do you find these? Well, here's a list. Okay, so I put these on here as far as the different ones, but I've included what that's called the grant policy statement guide from HHS, and it's a PDF in your materials from today. So you actually have a place to get to some of these, but this is where you get them. This is how they have put the cost principles put together. And we're going to talk about what those look like and how do we get to some of that stuff. But you do actually have a sheet for that about how to reference those things, okay? So the cost principles address 4 tests in determining if something is allowable, okay? So these are the tests. First of all is reasonableness, and that includes necessity. Like, we absolutely have to have this. Is it reasonable that you're asking for this piece of funding in your grant proposal? Is it absolutely necessary to your program? Okay, so that's one of the first things. That's the first test. And so a cost is reasonable if the nature of it or the amount of it does not exceed something that would be incurred by a prudent person. Notice I'm going to keep using that word. That terminology is used in the guidelines. It's used in all the literature that talks about grants and grant funding and grant writing, is what would a prudent person under these circumstances, at the same time, what would these costs be? So in other words, let's say the average cost of a cheeseburger is $4. Okay, let's say that's the average cost. So if you were going to say, okay, we need to feed, you know, $4, we want to feed 20 people, that's $80. So if you put in there that we were going to ask for $80 for cheeseburgers, that would be reasonable, right? We would need that to cover the cost of the cheeseburgers. But if I ask for $10 a cheeseburger, when the cost is actually only $4, then I've exceeded that limit of what a prudent person can be. So it's very important that you figure out, especially if you're up for a renewal of your budget and your grants, like, think about what the actual cost is. We all know that inflation is a big piece of things. We all know that a lot of times that our grants, you know, like what we consider sort of that cost of living increase doesn't really keep up, right? And so we have to think about that in terms of, what are we asking for that's reasonable? Do we need to bump the price? Is that what we see for the goods and services that we're providing? Can we show that that's the actual cost? Did we just tack on a couple dollars because we thought we needed to, or have we made a reasonable assessment for that necessity that we're looking at? The next piece we have to say is this idea of allocability, which I told you is also about allowable, right? So if we're looking about whether or not a cost is allocable to a specific grant, function, or your department, or some other component known as a cost objective, if the goods or services involved are chargeable or assignable to that cost objective in accordance with the relative benefits to this relationship. So a cost is allocable to a grant if it is incurred solely in order to advance the work under the grant, okay? It has to benefit the grant and the work of the organization, including other grant-supported projects or programs, or it's necessary, or it's deemed assignable, at least in part, to the grant, okay? And I'm going to show you, I'll give you a link here later, and I know you have it also in your tools, that it shows you how you can tell if something's actually allowable, okay? Like, it literally lists thousands of things that would be considered allowable or not. And so that is a good reference for you to go and look, to make sure that if you're trying to add something into your grant budget, when you're requesting funds, that you're not putting something down that's not allowable. Consistency. Recipients must be consistent in assigning cost to cost objectives. So if you're asking about somebody's time in part A, are you asking for that similar amount of money for a person doing the same kind of work when you get to section B? And in section C, have you been consistent across your grants when you're asking for funding, okay? So you don't, and you also want to make sure that you're not putting in duplicate charges. You don't want to ask for somebody's service in part A, and then they also help out in another area, so you're including them over there, and then it looks like you're asking for that same person's time twice. So you want to be very specific that this hours goes towards this piece of the program, and this person's hours for this much goes over here, okay? So you just want to be really careful that you're being consistent. And then finally, this last principle is conformance. The test of allowability is conformance with limitations and exclusions. They're included in the terms of the conditions of your award, including these cost principles. And they are going to vary based on the type of activity, the type of recipient, and other characteristics of your individual award, okay? So here's this one below here. So I'm going to show us this grants policy statement, and again, you also have this as a handout, but what's allowable versus unallowable, okay? So these 4 tests apply regardless of a category of costs and the cost principles that are awarded from that. And so we want to look at this. And again, if we click on this item real quickly, let me make sure it still works today. 217 pages long. Okay, but we're going to click down. Actually, I already went to here to page 82. So it actually tells you that it's section 2, pages 30 to 43. And I'm just going to show you a couple things like, so what's allowable? Okay, advertising, that's allowable, but only for recruitment of staff or trainees, procurement of goods and services, disposal of scrap or surplus materials. So notice how very specific it is if you say, okay, I'm going to advertise, but it has to be for one of these things. Okay, we want to have a fundraiser. We want to have alcohol. Is that allowable? No, unallowable. So see, it says this. So it's very specific on what it tells us, A, what counts as allowable, and then also specifically, right? So animals allowable for some things, but not for others. So there's literally 13 pages here of things that are bad debts, not allowable. You can't include that when you put in your grant management. If you have debt from a previous year, you can't put that in your new grant and hope that that gets covered. Okay, so this is a very useful tool. And if you're saying, I want to include communications, yes, on the surface, it's allowable, but it can include local and long distance telephone calls, telegrams, express mail, postage, messenger, electronic or computer transmittal services, and usually treated as indirect costs. So, and that's like a precursor into what we're actually getting ready to talk about, which is the difference between direct and indirect costs. And so this piece of it is interesting because sometimes indirect costs are not allowable. And you have to know whether your grant actually allows that or not. So in particular, this is going to allow our communications piece to be an indirect cost, and it would in fact be allowable. Okay, so let's go back to here and look at direct versus indirect costs. So direct costs are ones that can be identified specifically and with a particular award, project, or program, service, or other organizational activity that can be directly assigned to an activity with a high degree of accuracy. Okay, so direct costs include things like salary, travel, equipment, supplies, directly benefiting the grant-supported program. Indirect costs are sometimes called facilities and administrative costs. So if you've heard that terminology, and that kind of depends on whether you're at the local health department or whether you're working maybe at the state. So I know at the state level, what we consider your indirect cost is going to be considered your facilities and administrative costs. And these are costs incurred for a common or joint objective that cannot really be specific, okay? So, and what this big fancy definition really just means is, think about it this way. If you're using the telephone service in your whole department, okay, it's hard for us to say exactly how much your program is using for the phone, right? Because it's the service is for the whole thing. So we have to find some way, and we're going to talk about cost pools and cost drivers later, and to see where you guys fall as far as that goes when we talk about these indirect costs. And how do we identify that? But basically what we're saying is, if it's something that we can't say specifically, right? Like let's say you're going to hire somebody temporarily for the summer and you're going to pay them $15 an hour. That's a direct cost. We know that. We know how much that's going to be. We also want to make sure we don't forget the fringe and any benefits that we're providing, but we'll get to that later. But you also can say that's a direct cost, right? That's something that's directly included that you can write down, you know exactly that that's going to be to that person. But again, if we're talking about the telephone and we have a phone line that's set up in the office as a whole, it's more difficult to know exactly how much we're paying for that piece of it. And that's what would be considered an indirect cost, okay? And again, sometimes that's called facilities and administrative costs. So we have to think about, when is it an indirect cost? You also have a handout in your folder that can help remind you later that it's called direct versus indirect costs. So you can have that. So the purpose, when is it indirect? The purpose of the activity is spread over several projects, divisions, or activities. So again, my telephone example falls into this. That activity or the thing that we have to pay for, maybe it's your internet in this day and age, right? Maybe you have internet, you have high-speed Wi-Fi, somebody's paying for that, right? As far as like your overall health department, but each one of your programs and projects are probably being charged for that within the indirect cost, okay? The next one is, if it's difficult or impossible to identify or compute the cost of the activity for each individual project, program, division, or activity. So again, back to that phone or the internet, how can we tell exactly how much each piece is using that? And then finally, if the activity and that associated costs that go with it are necessary, right? Most of you couldn't even imagine going to work every day if you didn't have access to the internet. So is it necessary for you to do your job? Most of us are on this Zoom call today, right? We're using the internet in and of itself. So of course that piece would be necessary, but it again is more difficult for that to be, to how do we nail that down, okay? So are these indirect costs allowable? If we're asking for this money for a grant, can we say we have indirect costs? Well, the answer is that it depends, okay? So some grants don't allow any indirect costs. So if you were actually applying for a grant from the Bill and Melinda Gates Foundation, they don't allow indirect costs for any of the grants that they get. So those are very grant specific. Currently, if you're talking about DPHHS, all grants allow indirect costs, but some grants consider the indirect costs as administrative and others do not. So you have to be careful where you're going to classify those indirect costs. It's more typical that indirect costs are not administrative costs. The majority of the grant awards at DPHHS have language that states that indirect costs are approved under what we call a cost allocation plan. So again, for those of you working particularly at the state health department, if you're looking at that grant administrative cost, you probably have what they call a cost allocation plan. So you're allowed a specific amount that is set up that the state comes up with, that you would actually put that piece into that. So if you haven't done this budget narrative before, if you don't know what your cost allocation plan is for the year that goes for your indirect costs, you for sure want to talk to your budgeting people, your financial specialists, and all of you should be doing that on a regular basis. Probably if I ask this question right now that said, how many of you that are running a program spend any time with the financial specialist at your department? The answer is probably like, who's the financial specialist at our department, right? Okay, because so that's really one area that you need to work on. And you will notice, I will tell you this, and I got this notion actually from the subject matter experts who are CFOs at state health department levels, and they're saying program managers should be talking to their financial specialists on a regular basis. You really should be having meetings with them about once a month to see where you're at, and especially to check these indirect costs and see where those are hitting, to make sure that you are doing your best to be accurate when you're asking for your piece of this allocation plan every year, because otherwise you're going to get overcharged. And you don't want to do that, okay? Because then you're spending money that you don't have to be spending. All right. Okay. So sometimes how are indirect costs computed? So they're oftentimes computed using that percentage called an indirect cost rate. Okay, so that might be the way that they're done. The indirect cost rate is computed by the financial people in an organization, hopefully using generally accepted accounting principles. But again, in the case of the state health department, they use a federally approved cost allocation plan that I just mentioned because they are a public assistance agency. So there's a letter that's actually submitted with each grant application stating the use of the cost allocation plan. So again, if you're at the position where you're going to have to reapply for your grant and you are working at the state level, you're going to need to find that cost allocation plan, and it's going to need to be turned in and submitted with your budget narrative, okay? So the use of that cost allocation plan is when the grant requests an indirect rate. So if it's saying, what is the indirect rate? You say, here's my cost allocation plan. Here's what we have, okay? So what's the process to this? How do we get through each of these things? So each year, whether it's a brand new grant or the next year of a current grant, the program does what they call a cost allocation estimate request. And again, this is state level specific. Your local may do this as well, especially if they're following the principles that the state health department is doing, but this is actually what would happen. You do a cost allocation estimate request form. There are financial specialists within each bureau in the state health department, and that's what I call that FS, the financial specialist. So again, if you don't know who your financial specialist is, find out, okay? Knock, knock, knock on the door and figure out who that is, okay? So the program manager or the person who's writing the grant would work with this financial specialist to complete the request, and then the FS would send it on to the accounting purposes, the Financial Services and Operations Bureau, okay? So then they're gonna take that formal request to the cost allocation program. And based on the information that you're providing, right, they're gonna do a calculation on their end. And they're gonna give an estimate of what it's gonna cost for your indirect, okay? So you're gonna say, these are the things that I'm doing, this is my cost allocation form. So the more specific and the more correct you can be on that, they're going to calculate on their end and just give you an estimated. It's only an estimate, okay? The grant could be charged more or it could be charged less. So this is really importance of your documentation and keeping track. And we are going to talk about documentation at length on Thursday and the importance of doing that. And one of those things actually comes back to this piece of doing your indirects and the importance of keeping track. Okay, so you're going to need to document the activities of your grant so your estimate is as close as possible, because the financial people are need to be keep an eye on whether your indirects are hitting so that you don't get charged later at the end of the year, right? So that's another reason that you should be checking in with a financial specialist. Make sure that the indirect cost that you is in your cost allocation, is that actually what you're going to be charged for your grant? Because indirects are going to come out first. So if your indirect is off and they go to charge you more later, you're going to lose part of that funding that you thought, and you're going to have to find a way to make that up someplace else. So it's really important that you're having like this monthly budget meeting with a financial specialist, whoever is the one that is calculating your cost allocation for your indirects. Make sure you're keeping that relationship open, and that you're talking to this person on a regular basis. You should have good communication between them. Sorry, I went backwards there. So indirect costs are legally required to be paid first. So that's what I was saying. This is where you could run into some trouble if you don't have this indirect. The only time that they won't charge more than the estimate is if your grant has specific language that puts a cap on the indirect amount. So let's say your cap was $5,000 and the financial specialist was saying, we're going to charge you $5,500 this year. And you say, no, I can't, not from this grant, because 5,000 is the cap. So again, you need to understand not only the language in your grant as far as indirect, and is there a cap on that, but then also the communication back and forth with your financial specialist. Okay. So we've talked about the fact that we have in-kind contributions that have given us, like when people are giving their time freely, right? We've talked about direct costs, which are pretty straightforward. If we actually can nail that down and say, we're going to pay this person's salary, or we're going to rent this particular building and it's all for us, we know how much that rent is and we can put those things down. And we talked a little bit about these indirect costs, and these are the things that can get really convoluted very quickly. And we all use the indirect costs. We all use the phone lines and the internet and the heat and the air and the office space and the housekeeping. All of those things would be considered indirect costs. And so, but a big thing for us is, are they allowable? And if they're allowable, how do we know if it's allowable? We use some of those pieces that I just gave you, that big long 200-page piece of looking through. We need to be talking to our financial specialists in our departments, right? Who is helping us? Are we using a cost allocation? Are we using an indirect cost rate? Or are we completing this cost allocation form and are being given this estimate of indirect costs? And are we having conversations on a regular basis to make sure that what's hitting on our indirects is happening the way we think it is? Because again, as I mentioned, these are going to come out first. So the indirect costs have to be paid before your other things. So you don't want to be hung up where you've spent more money on this indirect and have to come back to it. Okay. So the next thing we're going to move in is to cost allocation basics. How about if we take just a couple minutes quick break so that everybody can maybe grab that third cup of coffee or maybe some water so that we're not so jittery for the rest of it. And they'll give you a breather after all this cost talk. And we'll see how we kind of can allocate those things. So let's just take a couple minutes and then we'll be back. Okay, hopefully we're all back. Can hop back into this and start talking a little bit more about some cost allocation basics. So here's where we really get into like budgeting 101 type pieces. So there's quite a bit of information here that we're going to try to get through. And so I know all of you won't be like, oh, let me just go talk about cost pools and cost drivers when I get home tonight. But also it's important for us to kind of realize where these pieces come from so that we understand how these things are being allocated for us. Because sometimes the person that is making these decisions doesn't necessarily understand how you're using these things. And so it can be really important for you to at least understand where it's coming from, potentially because you might be needing to be part of a different cost pool. There might be a better cost driver for you to be using as far as allocation of these resources. And so again, it's typically more than most of us want to do when it comes to budgeting, right? We're like, okay, how much does it cost? How much do we make? What's the budget? Like you all do this as far as home goes. And I know it's the same kind of thing when you're looking just overall at your grant, but because some of these things are done by other people, you need to sort of, especially when we're talking about these costs or indirect costs, you want to know where those dollar figures are coming from. You know, if your financial specialist says, hey, we're charging you $20 a month for internet, and you think, well, that's okay, that's not bad. But if every other division is only paying 10, why is that the case? Why are you paying more for internet than maybe another program that is working and using the same amount, or maybe has more employees than you? And the reason that might be is potentially because of your cost allocation rate, the cost allocation plan, maybe because you're being charged more for something that you're not actually using. So that was that first piece of like talking to the financial specialist. But the second piece of that is this idea of cost pools and cost drivers, and how are they coming up with these, and are you part of the right cost pool, and are you using the right cost driver? So if we can talk a little bit about that, I think that will help us figure out where we're at. Okay, so to assign costs from one activity to another, two important elements must be identified: the cost pool, which is a group of overhead and direct costs to be allocated. So this is like, what are we trying to pay for? Okay, that's what's going to be considered the cost pool. Who's in this together? And then the second one is the cost driver. And this is the basis on which a cost pool is allocated. Okay, so while a cost driver is that basis that we're allocating this, let's think about this. We'll give a quick example. So the cost of, let's say, a hospital. Let's use a hospital so that we're not doing state or local or breaking it that way. Let's say a hospital has a housekeeping department, right? So obviously all hospitals have housekeeping, and the house part might be allocated to the other departments based on the size of each department's physical space. So again, we know that hospitals have to do housekeeping like in the lab and in the patient rooms, but they also have to do it in the offices, right, of the people who work like in administration. So what they've done is they've said, okay, how about if we charge you for housekeeping based on the size of your physical space? That seems logical, doesn't it? Like, let's say your office is, 500 square feet. So you should be charged for housekeeping for 500 square feet versus maybe another larger department that uses 1,000 square feet. There should be charged for that 1,000 square feet. So the logic here is that the amount of housekeeping resources that are expended in each department is directly related to the size of the department, like the physical size of the department. So the total housekeeping cost would be the cost pool. Okay, so this is what we're talking about, housekeeping costs. That's the cost pool. And in this case, the number of square feet of occupied space would become the cost driver. That's how we break it down. So we say, okay, we're paying for housekeeping. And again, we could use my internet example from earlier. That's the cost pool. It's internet, right? And how are we going to break that down? So in this case, I'm saying, okay, for housekeeping, let's go by the size of, and that makes sense, right? We're thinking about it. How long is it going to take the housekeeper to clean? Well, a 500 square foot versus 1,000 square foot, right? That's twice as much time. So when the cost pool amount is divided by the total cost driver, the result is what we call the allocation rate. Okay, so when we take what do we have to spend and how are we going to divide it, makes sense, right? Simple division. Then we're going to do that. So in the housekeeping illustration, the allocation rate is the total housekeeping cost of the whole organization divided by the total space by my department, okay? Or every other department, right? Each one of those has to sum then to 100% of the housekeeping total, right? So this procedure results in an allocation rate measured in dollar cost per square foot of space used. Okay, so it's important for us, and again, that sounds convoluted quickly, right? So dollar cost per square foot of space used. So what you really want to know is, okay, what's the cost pool? So think about your indirects. Are you paying for telephone? Are you paying for internet? Are you paying, electricity? Do you have just a flat rate, right? Some of you may just be charged a flat rate for indirects, and that just may be what you're getting charged every time. But potentially you're not. Potentially you're part of this cost pool, cost driver thing. And so you're saying to yourself, okay, how are they figuring? What is the driver behind me paying for the internet? So again, if you don't know how this is done, you need to talk to the financial specialist and see, are you just getting charged a flat rate for all of these things? Or are they specifically figured up based on your space, based on how many people you have in your program, based on how much money you bring? So potentially you or your program makes more money than somebody else's. So you're getting charged more for your indirects than they are, which should not be happening. But you want to double check and make sure that that's not the case. Okay, so we get this allocation rate. So in the housekeeping illustration, the allocation rate is the total housekeeping cost of the organization as a whole divided by that square footage occupied by the departments receiving. This procedure is this allocation rate that we're doing. So in the patient services department, full cost would include the direct cost of the department and then an allocation rate for the housekeeping services made on the amount of the occupied space. Okay. So if we look at it this way, cost pools, a cost pool typically consists of all the direct costs of one support department. So think about support. So maybe even this is like accounting or payroll, right? Maybe you have payroll that does, think about that. Payroll does payroll for all of you, right? If you have a payroll services, then potentially, like, what does that look like, right? However, if a single support department offers several substantially different services, and the patient services department uses those services in different relative amounts, it might be beneficial to separate the cost into multiple pools. Okay, so this is where it gets kind of tricky. So we might say, okay, health department, right, as a whole, and maybe we're saying we'll just break it down by division, like back to that org chart, right? Let's say this division, this division, this division. But if we look at that, we can see some of those divisions maybe don't have very many programs underneath them. So potentially that might not be very good for us, because what if we only have 2 programs worth of people and they only have 4 people in them? And we're saying we're paying, let's say we have 5 divisions in our health department. If we're saying, let's break that up by division, everybody pays 20% of payroll. Well, that's great. If you're the division that has 10 different programs, you're not going to pay very much for payroll. But that's terrible if you are the division that only has 2 programs and only employs 4 or 5 people, right? So you really want to be mindful of, like, how are these cost pools being divided, okay? So let's say we'll stick with this hospital example of the financial services, okay? So in financial services, there's 2 different kinds of service. There's patient billing, and then collections, patient billing and collections, right? That's one thing. And then they also have budgeting, because the financial people are going to do the budget for the whole hospital, but they're also going to be the person taking in the revenue and keeping up with the patients and the billing and that kind of thing. So there's 2 different things going on here, okay? So if we look at routine care is going to use a lot more of the patient billing, right, than the lab department. So lab department's not really billing people, are they? They're over here running labs, doing stuff. They're doing the technical side of everything. And over here, the care facility is doing this billing. So, but the lab is going to use a lot more of the budget, right? Because they're going to need their speakers and their equipment and their chemicals and the things to do their lab work, right? So there's a difference here. And so in this situation, it would be best to create 2 cost pools. One for the support department, for financial services, we need to split that. We want a billing pool and we want a budgeting pool, because it's not good to combine the whole thing, because somebody's going to pay way too much and for one thing and not enough for the other, and vice versa, okay? So then the cost drivers could be chosen for each pool, and then the cost would be allocated to patient services on one side, and then we would talk about the other way, okay? So I'm going to give you a really a quick little example from cost pools from the state health department. Okay, so this is from Montana CPHHS. So some of you might be familiar with this. So if we're looking at this, these that are listed on the side here, and again, this is an older example, it's a couple of years old, but I just pulled it so we would have something to look at today. So these are the account codes that the indirects post to, and the 2-digit number after that corresponds with the cost pool, okay? So if we look at this, here's the accounts that are coming from, and then here's the cost pools that it comes out of. So here's the different cost pools, so you can sort of see these different things. This is what your program would see if you ask your financial specialist for expenses by account code. So remember when I told you to go have that meeting with the financial specialist? Yes, when you do so, then you want to actually ask for the cost pools. You want to talk about the account codes, and then you can see how are you being billed. You can look at the different things, see all these things that are indirect costs, and where are they coming from, which fund. This is all in this fund, and here's how much they are for the month, and here's how much it ends up being for the full year. And this is where it's getting charged to: number 4, number 1, number 6, number 7, number 9, and number 16. This is what you're paying for, okay, when it comes to those cost pools. All right, so that's just an example. And again, you can get that from your financial specialist at the state level. And if you're at the local level, you have some sort of financial specialist, and it may be, maybe you guys are using somebody outside of the department. Some of you that are maybe city counties, you might actually have it like at the county level. So you might have to make a trip to somebody to get to talk to them about your cost pools and cost drivers. So again, cost drivers, this is kind of the most important step in the cost allocation process, is identifying proper cost drivers, okay? So traditionally, overhead costs were aggregated across all support departments and then divided by a rough measure of organizational volume. And then that would give us some sort of generic dollar amount. So those inpatient overhead costs of that hospital might be divided by total inpatient days, right? And that would maybe give us an allocation rate of patient, so many dollars per patient day, which is called the per diem overhead rate, right? So let's say a hospital had like 72,000 patient days, and the overhead cost was like 36 million, okay? So I'm just throwing these numbers out there. You would take that 36 million divided by the 72,000, so it would give you like $500 per patient day, okay? So it would be regardless of the type of patient treated. If we do it that way, we're just saying it doesn't matter if they're adults, if they're children, if they have trauma, if it's an illness, is it acute versus critical care? So it's just a flat rate, right? And so it would be applied to determine the total indirect cost allocation rate for that department. But some of the overhead costs are not necessarily tied to the number of patient days, right? So a good example of this would be admission, discharge, billing. Those are not related to the number of days that you're there, right? Some of the costs are related to the number of days you're there, but like admission, you only do that on the first day you're there. Discharge, you only do that on the last day you're there, right? And billing for those services happens probably while you're still there. No, I'm just kidding. But it was after you leave, right? But think about that. That's not really tied to patient days. So it'd be really hard to allocate the rates for how many billable hours are you getting and how many admissions did you have. So tying all those overhead costs to one cost driver improperly allocates the cost. So that distorts those costs for patient services and then raises concerns about the effectiveness of decisions when we base them on those costs. So basically now that we've moved into more state-of-the-art cost management systems, these overhead costs are separated into different cost pools, and then we decide the most appropriate cost driver for each pool. So the theoretical basis for identifying cost drivers is we want to know that the pool doesn't vary so much from the driver, right? We want to know that the driver is the correct thing. So let's say this. Let's say that patient services department has 10,000 square feet of space. Do they actually use twice as much housekeeping as one with only 5,000? Okay. Well, again, space-wise, it sounds reasonable. If I say to you 500 versus 1,000, and if you're going to clean 500 square feet versus 1,000 square feet, it seems reasonable that you're going to spend twice as much time doing that. But that's not necessarily true, because what if half of yours is a storage closet that doesn't get touched? Okay, so now you're getting charged for half of the space that's not even being used. Okay, so we want to think about that. So maybe a better relationship could be if you looked at what the cost driver was for perhaps how many people are in that office, how many desks have to be cleaned, how many trash cans are there, things of that nature. How many times a week is that used? Does it have to be cleaned more than once? Like, think about this. If we're talking about that hospital example, we could very easily say that a patient's room has to be cleaned on a regular basis, right? Every day or every other day or however that works. But maybe the office space only gets cleaned once a week, right? So you don't want to pay like you're getting cleaning services every single day, right? So we don't want to just make it based on how much square footage we have. We want to think about fairness, right? Does the cost driver chosen result in an allocation that is fair to the patient services department or to your department, and if you're looking at it for you? And so does that cost driver create incentives for departments to use less of that overhead service? And this is a really big deal for you as a manager. So I'm going to say that again. The cost driver chosen, does it create incentives for you to use less? Okay. Are you able to then become more efficient and effective because you can cut out some of that? Or it's just everybody overusing everything because you're getting charged that flat amount. So what is the incentive for you to use less of it, right? So again, the first thing you want to do is find out where your costs are coming from. Where do you get those indirect costs? Is it an indirect cost rate? Are you paying based on cost pools and cost drivers? Are you paying based on a cost allocation plan for the year? And is there a way for you to make changes to that would be more efficient and effective for your particular program or project? And how are they figuring these things? How are they calculated? And that's the thing about people who are doing the calculating. They actually know. They can tell you. They can tell you exactly how those are being allocated. And then you could argue, against that if necessary, or you can at least know why you're paying the amount that you're paying. And does it seem like that's a fair payment? Okay. So we want to look at that. So do you have an effective cost driver? What's the cost pool that you're talking about? How is that calculated? What is the cost driver from that? Okay. So if we look at this, one thing is rent. So from DPHS, so here are some of the cost drivers that they use. Rent is by square foot based on the space each program uses, plus a little extra for common areas like walkways and conference rooms, etc. This charge is allocated to the grant by a speed chart, but comes through in an indirect cost allocation. Okay, so again, this would take some time for you to sort of look at your budget, what your grant says, and what your financial specialist is talking to you about as far as how we allocate these things that come through for this. So again, rent based on square footage. That makes sense, right? Again, if we're talking about how much you're paying for space, you obviously want to pay for the 500 square feet you have versus a flat rate, so that somebody who's got 1,000 square feet is paying the same as you are. That wouldn't be fair, okay? So IT is the same. It's allocated to the grant by a speed chart, but it comes through as an indirect or a cost allocation. Each month it shows up on the budget reports in specific indirect cost allocation account codes. So programs can ask for a breakdown to show them the pools if they want to know what the costs were. So if we look at a couple other examples, the branch manager, administrator, and bureau chiefs are broken down by FTE. So the more FTE on your grant, more shares of those costs you're going to see hit your grant and your fund. So based on what you've got as FTE in the grant, that's how you're going to get branch manager, administrator, and bureau chief. And then the next one, the rent. If you want to talk about rent, IT charges, and mail, those, like I said, are speed chart, but they still run through that cost allocation. And just in case you didn't know, the speed charts are what is used at the state level to code for specific grants or funds. Okay, so it's just a nice big chart of all the different grants that are coming in at the state level and how those are specified and allocated. Okay, so then this piece, the budget analyst, the financial specialist, general ledger, and your legal charges, so all those are grouped together. Those are allocated by time spent on the specific grant through TARTS, which is time allocation and the request tracking system. So these positions actually will all charge in 0.25 increments to a specific grant that they're working on. So again, it's important for you, how much time are they spending? Is there a way for them to spend less time? Do you need them to spend that much time? Notice you're paying for the financial specialist here. See this little piece right here where I said financial specialist? So your grant is paying for that. So this is another reason that you should be talking to the financial specialist, because you're paying them, okay? So you want to make sure that what you're doing is in you're all on the same page on a regular basis. So that's being charged through the TART system at a 0.25 increment. And that's specific to the grant that you're working on, okay? Okay, so another thing is, here's things that influence indirect costs. Staff, payroll, the number of contracts you have, and purchases for budgeting, okay? So here are things that count as indirect costs, which would be facility, electricity costs, heating bills, water bills, maintenance costs, central administration like payroll, right, in this case. Now, if we talk about direct costs, there are 9 of these, okay? And again, these are pretty relatively straightforward. I want to go through them. We'll go through fairly quickly just so that we kind of know what they are. You do have this in your folder as well. So you have these handouts to take so you don't have to remember all of this for today. So personnel and fringe, travel stipends, honorarium, services and consultants, real property, equipment, materials and supplies, and facilities. These are the 9 categories. Again, they seem simple enough, and they all fit. Everything that you can think of that's a direct fits into one of these categories. We could just call them direct, right? We could very easily just be like, oh, these are the direct costs. But we actually want to think about it because it's better for us if we break it down, because we want to see where we're spending the most amount of money, okay? So if you have your budget and you're saying, oh, these are the direct costs, do you have it broken into categories where we can sort of see where we're spending this kind of money, okay? So we could use fewer categories. We could put all of, materials, supplies, and equipment all together, and facility. We could put all that into one group, but more categories makes the explanation easier. And it helps us, especially when we're writing that budget narrative, to say, what exactly is the money that I'm putting in here? One thing you're going to notice on here is that I don't have a category for miscellaneous, okay? If you have a category on your budget for miscellaneous, get rid of it, okay? That's what I'm going to tell you. So what you want is this. When you have a miscellaneous category, you want 0 in that every time, okay? Because here's the thing. If you have a budget form, if you're putting in a grant narrative and you put in miscellaneous, what that tells the grant people on the other side is that's sort of like your little slush fund. Like maybe you couldn't figure out what your budget should be as a whole, so you included what they consider this miscellaneous item. Now, a lot of them will allow you to have miscellaneous. So for instance, I'm going to go back to my basketball booster board. When I was the treasurer there, I had categories, classifications for everything that we spent money on and everything we brought money in as far as revenue goes for the program. But some things it was like, oh, this could be just like some random something and I didn't have a category for it. Well, I can put that into miscellaneous. I was allowed to do that for up to $500 a year. But really, if I thought about it, there was probably a category that either I already had or that I should create, because potentially we were going to get more money for that later from somebody else, like if that's a new category that came up. So in other words, if I threw it into miscellaneous, I was really just being lazy and not adding another line to my spreadsheet, right? So you don't want to do that. You don't want to say, oh, I can't be very specific about what's in my budget that I have this miscellaneous category. So if you have to put something in there, if it is something rare, something crazy, that's fine. But what we really suggest is keep that at 0, okay? What you want to show them is that you actually know exactly where the money's going. You know that you've done the best job you can to say how you're going to spend that money and you're going to stick to it, okay? So you don't want anybody thinking you've got a little slush fund there, okay? And a lot of times if you ask people, like, why did you put this much for miscellaneous? It was because like, well, what if I was off by a little bit here, okay? So you don't want to really do that. You don't want that contingency fund, because that tells the grantor that you're unsure of your budget, or that you don't have faith that you can find and compute all the costs that you have in your project or budget, okay? All right, so let's talk a little bit about personnel and fringe. This cost is for paid personnel, okay? So paid personnel obviously can be full-time or part-time. They can be paid a salary or they can be paid hourly. The key to putting a person's wages into this category is that your organization, or maybe your partner organization, is responsible for withholding taxes, okay? So if you're withholding taxes, then that person is an employee, okay? They're an employee, so this is personnel. And you're thinking, well, duh, okay? But we have to be really careful, because we may get into some service providers, contractors, consultants, things of that nature. And those people are not necessarily considered personnel because you're not withholding taxes. So again, that's the stipulation here. If you're withholding taxes from somebody's pay, then that person is an employee. So wages paid to employees go in this category. So it's a direct cost that goes under the personnel and the fringe. Now, the fringe, this is the thing. It's so easy to forget about the fringe, okay? And it's really important that you don't do that, because this refers to the amount of cash that it costs your organization for an employee over and above the wage. Fringe is made up of several different things, and they're paid by the employer, okay? Some of these are paid by the employer because they have to be. Some of these are paid by the employer because we promised them to the employee, okay? So matching Social Security tax is included here. Matching Medicare tax. If you put these two together, those are known as PICA. State unemployment insurance and federal unemployment insurance, which is known as FUTA. Workers' comp, and any benefits that your organization is going to provide. Health care, life insurance, dental care, retirement fund. Your organization may pay all of those or only some of those fringe items that might be included, okay? So when you're thinking about the allocation rate, let's say you're gonna hire a new person, and you're like, well, gosh, the market value for this person is $20 an hour. I have $20 an hour times a full year's wages. Here's what I can pay them. Not so fast, because you can't actually pay them that money, that $20,000, okay? What you have to think about is, if you can afford to pay $20,000, how much of that is going to go to fringe, and what's left over is what you're actually going to be able to offer that person, okay? So you're backtracking here, and people forget this. So when you're adding new people, new employees, new programs, new stuff to your program, you have to be very careful that if you have X amount of dollars that you can spend overall, that you have accounted for what you're actually going to have to spend in the fringe that goes with that person's actual wages. So you can't pay them the full 20,000, because then you'd have to pay the fringe on top of that, okay? So fringe is calculated as a percent of wages, and your payroll people know this, okay? And look, fringe can be as low as 10 and as high as 50. The average is typically 32%. So again, if you request $20,000 for your project director, and the fringe rate is 32%, then the project manager is not going to receive 20%, but the smaller amount after that fringe is taken out. Okay, so you're going to take out 32% of that 20, and that's all that you're going to have left. Well, now you've made a promise to somebody that you would pay them $20,000, and you can't actually pay them $20,000 because you've got 32% fringe that has to be taken into account. So seriously, the number one thing, and people forget this, like I said, when they're doing this grant, is what is the fringe? You start paying people for services, and you forget that you have to include this fringe part, and then you're going to be in trouble really quickly, especially if it's running up close to 50%. A lot of organizations pay less per hour because their fringe is so high, because they pay for full-time health benefits and full dental benefits. They have so many paid days off. They have so many sick days that are allowable. And so a lot of times that fringe is actually up to 50% of somebody's actual salary. So you have to be very, very careful here, okay, to make sure that we're not having that problem. And we also want to make sure that we're not supplanting our rates, okay? You want to make sure that we're not using the budgeted amount for something other than what we say it is, okay? We don't want stuff going back into general funds, so be really careful about that. And that most of us are not doing that on a regular basis, but we just want to make sure that what we're spending our money on is exactly what we've said that we're spending on. We don't grants don't look kindly on that when the money that they've given us that we say is going to go to a specific thing gets like put into a general fund that is then spent for like whatever needs to happen. It needs to be very specific, okay? So you want to start thinking about that, especially if you're going to be writing a new grant anytime soon, or you have a grant renewal coming up. Think about the different costs that you're going to have. And again, we're going to talk about budget narratives on Thursday and how to put those things in. But again, looking at your budget, if you can take some time and spend with that budget, talk about whether or not you've got an expense or a revenue or an operating budget. Like, what are you looking at here? What is your indirect? What are your direct costs? How are your indirects allocated? What are the cost drivers and cost pools? Are you using a cost allocation rate? What can be cut? Are you being specific, right? So we just talked about the personnel and the fringe, but also travel. Travel includes all kinds of things, right? Getting from one place to another, eating and lodging. And sometimes you can include travel and sometimes you can't. You know, sometimes it's just a flat rate per diem, like at the state, it's like whatever it is, $15 a day, and that's it. Do you get to include tips? Do you get to include parking? Like if you have to go to the airport and you've parked your car, do you have to include that when you're having somebody come? Can you do that? Can you pay for their parking? Do you need somebody to go pick them up because you're not allowed to pay for their parking, right? How do we get that? So travel itself is usually thought of on ground or air. And so we can see these different kinds of things. So there's a lot of different options here, but like I said, be careful that when you're allowing for these travel stipends that you know what your limits are, okay? Because like I said, most of you are given some sort of limit either based on a state rate or maybe on your city county rate that you can say, okay, here's what I'm going to give you. Even if it costs more than that for somebody to eat, you know, the majority of us have probably had a travel stipend at some point and said, that dollar per day is not covering it, but that's what you can offer. So that's what you have to be straightforward with that. Stipends are the same way. Sometimes these are associated with trainings. They have pre-established levels. So you can say, okay, we're gonna hire this trainer to come in for something for XYZ, and this is what we're spending on this training every time. So that's a stipend. So it's just a regular or fixed payment for services. It's not a wage because you're not withholding taxes per se. You're hiring somebody off the street. So again, this is why it's a good thing to kind of break these down, and you can really see where that money is going. You don't want to just be like, oh, well, we paid all these people. Which people did you pay? Which ones are employees? Which ones are something different? What's considered the stipend? Honorarium, same way. A lot of times these two words are used like interchangeably. If somebody just shows up, usually though an honorarium is something that you just give them. You give them a gift for showing up. So like, let's say you have a guest speaker at your gala. You might give them an honorarium for speaking. There's not really a contract. You just hope they show up. You've decided that they were great and you've told them that they were great and they show up to give a little talk to pep up your program, and then maybe you give them a one-time something, right? So they're not actually, it's not a goods and services kind of thing versus the stipends. So that's something different there. And then services and consultants, notice there's a ton of these that could be on there. And so, and some of you probably don't use any of these. You're not hiring out for any of that. But on the other hand, some of you may be doing these things. You may be hiring services and consultants for something like that, advertising or communications. Remember, we said that those were allowable costs in some of those grants. So can you use this? Do you have to go someplace for video production? If you're doing services and consultants. So they're naming them separately because these are not employees, okay? These are useful labors performed by an individual or organization on behalf of others. So this is a few of them that I'm gonna list here on the slide. So you do have, your paid staff perform services, but we don't consider those in services and consultants because you're paying them a wage. You're withholding taxes and you're taking into account the French, right? So that is a different thing. But if you're paying for somebody on the side of this, those are considered services or consultants and you're not withholding taxes for them. So the difference is that these are not your employees. You're not withholding taxes. You're not paying French, okay? I can give a good example of this. I was hired as, I did a foster care evaluation a few years ago, and I was hired as the evaluator. So I was providing a service. I was a consultant. I was not an employee of the health department, but I was somebody under the grant who was paid a service for doing the evaluation, right? So taxes were not withheld. I had to pay those on my own as, you know, a 1099 indirect consultant because I was considered this. But you want to be really careful about whether or not you're considering somebody a service or consultant or if they're actually an employee, okay? Because the IRS does not like it if we accidentally put somebody into the wrong category. Okay, so make sure that even if they're tax exempt, they're doing their things, that you're not to the point where you need to be taking wages and paying French for them. Okay, so you want to be very careful about how you use those contractual services. There are IRS rules about who is considered a contractor and who is considered an employee. So you want to know that you understand the differences and abide by the rules. You can get a description for the use of this from the CPA that you use, your financial specialist, or actually from the IRS directly. They've got pretty good information on their website because they want to make sure you don't make that mistake. Back to that real property. Remember I said that there was a very specific definition of what real property was: land, buildings, soil, trees, minerals, water. So if you're talking about, if you're categorizing something as real property as a direct cost, it has to be one of these very specific things or it's not property. Equipment. This is, let's think about equipment. Okay, so here's our definition. So if we think about this, and I'm going to back just so you read it, you've read it already, it's fine. But let's think about this. If we thought about equipment in your organization, right? Maybe it's in your, is it expendable, but in another it's not. So let's think about this. If I asked you, if I said, is an electric drill a piece of equipment? Like if you have one at home, you have an electric drill, would you call that equipment? What about a bathroom scale? Is that equipment? How about the chair that you sit on in your desk? Most of us would probably say that's equipment, like we're using it, right? Like it's equipment is a piece of something that we're using. So, but let's look at actually the definition for equipment, okay? If we look at this, we can say tangible, non-expendable, so that's things we don't just throw away. So that would be our drill and our chair and our bathroom scale, although most of us want to throw away the bathroom scale at some point. But the truth is, it's a non-expendable item. Directly to an award having a useful life of more than 1 year, which all of those qualify. But here's the part that gets us: an acquisition cost of $5,000 or more per unit. Okay, so probably that drill we use at home, probably the chair we're sitting in, and probably our bathroom scale do not hit that $5,000 mark. Okay, so what might be is like the copy machine at work. Like if you have a super expensive copy machine, that would be considered a piece of equipment. It's non-expendable. It has a useful life of more than 1 year, or you got a lemon, and it was more than $5,000 per unit. Okay, so if we think about that, that is what we consider equipment. So this is why it's different on a category when you're like listing these things out. So equipment falls into that category. So if we were actually talking about the drill, the chair, and the scale, none of those are considered then equipment. Well, if they're not equipment, then what are they? Okay, so again, if I just covered all this. And sometimes you'll actually see a cap. It has to cost at least this much, but can't cost more than this much, okay? Because again, they're trying to keep you to having things that are cost prohibitive. So materials and supplies, this is a pretty easy looking definition, right? Materials and supplies, everything that's not equipment. That makes sense, okay? Because that is where all the other things fall in line that we would categorize. So for most of you, you're not having equipment, okay? So we know intuitively and practically what supplies are. Supplies are expendable things like ink, paper, lab chemicals, pencils, food, toilet paper. So that's pretty easy. We can be like, all right, those are all supplies, right? We all know we have, what supplies do we need? We say that, right? Do we need more paper clips? Do we need this? But if we think about this, what about a USB drive for your computer? It's way too cheap to be equipment, but it can last a long time. So it's not really expendable. What about the wiring that we have in the wall for our computer network? It's not equipment, but it's not expendable. And maybe it sits in the wall for years and years doing its job. But if we look, these would actually be supplies, okay? So here's some places that we can distinguish between the two. Items such as USBs, and they're classified as materials. So often items are called materials are books, computer software, the stuff which we build things like glass or plastic, metal, and video, audio, digital tape. So here's what's lucky. It can be very difficult to tell. We can tell really easily if it's equipment, right? Because there's a dollar amount, and maybe it's at 5,000, maybe it's 3,000. You'd have to be specific onto what's considered equipment. But when we get to the material and supplies, it's a little more complicated as to how we tease those out. Luckily for us, most of the time, they lump these together. So if it is your ink or your USB drive or whatever, if it's not equipment, it probably just goes into here. So you don't have to worry so much most of the time on breaking down the difference between materials and supplies. You just need to have a category that has both, okay? And then of course, facilities, these are real property and it can be purchased, leased, rented, or used at no cost, which would be an in-kind contribution, okay? Okay.
I'm ready
so
for
again,
if you are, when you are.
you ready for what?
I said, I have the poll ready when you are, when you're ready.
Okay, perfect. You do. Okay, so good. Well, let's throw that one out there. Okay, so if you guys want to answer this poll, there we go. Here we got some responses coming. Okay, so let's look. You want to, can you share the results with them, I think? Yeah, there we go. All right, so It's actually all the above, right? So it's staff, payroll, number of contracts, and your purchases for budgeting. Those all can influence your indirect costs. Okay, so any of those pieces actually can influence what we have as far as indirect costs, because it's how much we're actually going to end up paying into staff, basically, because right, that's going to be your fringe and your payroll, number of contracts, and purchases for budgeting, right? So the answer for that one is actually all of the above. And do we have, is there one more? Yes, okay, let's ask the one more question. Okay, so this question asks, out of the direct costs we discussed, which one is the most often forgotten by the grant managers? Right, you want to share that, Desiree? So look, you guys, so I know you learned one thing today, for sure. We got 100% of you said friends, and that is correct, right? So you did hear me say I'm certain more than once. Don't forget the fringe, okay? Because that's super important. And I know, you know, like I said, lots of times that I've had this discussion, you know, people really do think like, oh, we need to hire somebody $18 an hour. But how much is that actually going to cost you to do that, right? So be really careful that you're adding that into your cost allocation before you go making, you know, hiring somebody else or using them as 0.5 FTE or whatever it is that you're doing. Are you really able to actually give them that as far as the wage piece of that goes? Okay. All right. So thanks for sharing those. I appreciate that, Desiree. And let me click back over here. So documentation. Take this off of here. We're going to talk a little bit about cost distribution real quickly, and then we're going to be done for the day here pretty quick. So we'll come back and finish up on those things then on Thursday. But I want to talk, and we're going to spend time again on documentation on Thursday, but we really want to talk about that the requirements for grant proposals, accountability is really high, okay? So you have to adhere to the grant budget for the duration of the time period that you have your grant, and any changes that you're making have prior approval, okay? This is one that I can't tell you how much CFOs, financial specialists have said, don't make changes unless you have prior approval, okay? So for any reason you have to make changes, and this, you really have to get approval before what you're doing. And you can get, only after approval can changes be made. Notice I said the same thing twice here, 2 different ways. I just said the same thing. Don't make changes till you get approval first, because you don't want to deviate from what you have said you're going to do. Remember the very first thing I said at the beginning today? What do managers do? They do what they say they're going to do. And one of those things is that we don't make any changes to this grant or to the budget to how we're allocating these funds unless we have gotten, unless we've actually gotten it. So we're going to talk about documentation, and I'm going to come back to this on Thursday when we talk about it, but I really want this to seep in. Don't make changes to your grant budget unless you have approval to do so, whether that's the local or the state or the federal level for doing so. And if you're going to need to make changes, make sure on your next grant cycle that you are moving that. That's one thing people forget, is that you're like, oh, I've had the same budget forever. This is all they're going to give me. And you turn it in and you realize like, oh, I actually want to spend money here instead of here. So if that's the case, change it before you apply for that grant again. Okay. Just be very, very careful that you're not, do what you say you're doing, do exactly what your grant says. You don't ever want to risk losing funding because you didn't follow that properly. So documentation is super important. So let's talk one real quickly about different types. And again, this or you want to be like, la, 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 don't like this stuff. But it's important for us, okay, just to understand the different kinds of costs. So we talked about indirect and direct costs, but we want to talk about the behavior of costs, how we can calculate those over time. So there's 4 different ones. I have them listed here. They're fixed, variable, mixed, or steps. And we literally have this little chart here that shows us if activity goes this way, what happens to cost. Okay, so obviously following this line, if activity increased, and then cost would increase here, right? Like, so this would be cost goes up and this would be activity goes up. That's how this little graph works. So the first one that we want to talk about is variable cost. So variable cost, I've drawn this line in here, okay? So a variable cost is directly related to the volume of services delivered. For example, the cost of clinical supplies. If you buy 100, it's $100. If you buy 1,000, it's $1,000, or maybe it's cheaper because you're buying in bulk. So here's what it would look like, right? So let's say we got to 100, that would be $100. If we went over to 1,000, that would be $1,000. So it's going up. So it's like a positive sloped line, right? So that makes sense. Variable cost. The more we buy, the more it costs. That's easy. That's what we can typically think of, something that is in our head pretty easily, right? So the next one is a fixed cost, and it looks like this. It goes straight across. So the cost is not related to the volume of services. Doesn't matter. The activity, this is how much it is, okay? So for example, facilities cost doesn't change. So let's say this. Let's say you're paying rent, right? Let's say your rent is $500 for your space. It doesn't matter if you work 5 days or 7 days or 12-hour days or 6-hour days or 40 people show up or nobody shows up. Doesn't matter. Your rent is the same. That's a fixed cost. Okay. So that's not going to change over time. Not going to impact your budget. Now it may impact your budget year to year, but it's not going to impact your budget month to month or week to week, right? Because it's a fixed cost. You know, just like if you signed a lease with a landlord, you know, at least for the next year, that's going to be a fixed cost. And that's a really good example that we'll use for the next one in a minute. The next one is a mixed cost. So this is a fixture of both variable and fixed. So notice here we have this dotted line. That's going to represent the fixed cost. And here is going to represent the variable cost, okay? And so when we say it like this, it has a variable and a fixed piece. So one really crazy example for some of you who are as old as I am, you will remember cell phones originally, way before the advent of the iPhone that does everything for us, right? So an example of this would be that you had a fixed cost for the line every month, right? Which we still have that, right? You still have that fixed cost and says, okay, here's how much you're paying. But remember the old days where you used to have to pay like 5 cents per text message? Imagine how much money we'd spend today if we were paying that person that sent on the text, right? But we used to have to pay that, right? Back when we had those little flip phones where the all day long, right? So we paid for the line. So let's say the line was $9.95 a month, but we were paying a variable cost of how many text messages we were sending, right? So we had 2 components to that same cost. So you have to think about that. Is this actually fixed or does it vary? Or is there a point in time, is it do both? So that would be considered a mixed cost if you're doing both of these things, okay? And then the last one that we want to talk about is step cost. A step cost looks like a fixed cost, but it's going to jump radically at a certain level, okay? So let's look at a particular example of, let's say, a healthcare worker, okay? So the total cost of a healthcare worker, and we can think about this in terms of one worker is $50,000. That's how much we're going to pay them for the year, $50,000. So of course, if we have 2 healthcare workers, that's $100,000. Totally makes sense, right? We got it. Now, think about the number of patients each healthcare worker can see, okay? So we're going to say that every one of these, for every 20 patients, we need 1 healthcare worker, okay? So that makes sense. Okay, we're saying, okay, we're going to pay this person $50,000. They can see 20 patients. We're going to need this 1 healthcare worker. So just to break this down, for 40 patients, we're going to need 2 healthcare workers. For 60 patients, we're going to need 3. So this makes total sense. We got it, right? We're going to need $50,000 for every time, $100,000 for 2. Okay, we got it. Now, let's think about the cost for that, though. The cost for this is 1 healthcare worker is $50,000 for 20 patients. But as soon as we hit 21 patients, now our cost has to jump to $100,000. That's a step cost. So you're at the same, you're at the same, you're at the same, boom. Okay, as soon as you do that, because now you can't see 21. If you have to see 21 patients, if you're legally obligated, required to do so, you would either have to say, oh, we can't see any more than 20 patients, that's it, that's the cap for us. Or you would then have to hire another healthcare worker that if you're hiring, and again, some of you are thinking in your head, well, I would just hire them for halftime and it would only be $25,000. That's true, you could do that. But in this particular example, let's say you were hiring full FTE, right? So if we were doing that, you would have to jump from $50,000 to $100,000. So that would be your step cost, okay? All right, so now we've talked about fixed, variable, mixed, and step. So in your, to just finish out for today, we're gonna see, in your folder, you have what's called, identifying direct and indirect costs, and fixed, mixed, and step costs. So I'm going to give you just a couple minutes here to look at these so you have them and see if you can't fill in which are direct or indirect, fixed, variable, mixed, or stepped. Some of them may be more than one. You'll see in a minute. So we have just a little practice budget that says salaries total, and let me see if I can have the blank one. I think this is my blank one. Yes. Oops, doesn't want to go over there. Okay, so it should look like this. And again, you have this in your handout. So if you want to just take a couple minutes, and then we'll either go over it today, or if we run out of time first, so you can have a minute, you can actually take this as to work on. Let's do it that way, probably, because you probably got 5 minutes here. You want to start to look at it, and then I will give you the answers to this on Thursday. See, that's our big teaser to come back and see which one of these we got right, because I'm sure you're going to nail them all. So again, there's 2 different categories here. So you want to look at this, and I have listed what they are. So the number doesn't matter up here. Just notice that I have these as expenses. And then this is, so clearly we're looking at a what kind of? Do we see anything? Are we bringing in any money here? Don't see any revenue. So this is an expense budget, right? This is not an operating budget. This is an expense budget. Notice how it says here at the top, expenses. So there's the first thing we can do when we're looking at that budget. And then here's the different categories. So again, I provided this for you just to show you that I did in fact steal it from somewhere, but we don't need to know the dollar amounts. What we're trying to say is this a direct cost or an indirect cost? That's the piece that goes here. And then can you identify, is that a fixed, a variable, a mixed, or a step cost? So again, I'm going to just come back over here. You can be looking at this, or you can work on it before Thursday, and I will go over that at the very beginning. The other thing I just wanted to talk to you about is what we're doing here, this relevant range. So cost assumptions are based on a relevant range. So when you are renting office space for, say, $600 a month, right? It doesn't matter how many patients you see. You're renting. That's a fixed cost of $600. But let's say you work 24 hours a day, 7 days a week, and you see 400 patients a month, but you want to increase the services another 100 patients. We can't do that because we're at room capacity and we've used up all the hours that are possible. So in this case, we would need an addition or a bigger office, which means our rent would increase. So the cost assumptions we have are based on this relevant range. So this is what they talk about. So when you get outside of that, all the assumptions that you've made about your costs are not correct. This is why I said it's really important for you to look at your budget on a regular basis, monthly, maybe weekly, for sure, month to month and year to year, and what your grant's doing and what is the funding you're asking for the next 2, 3, 5 years, however your grant's coming in. Is it yearly? To make sure that you're not getting outside of that relevant range, that what you're putting in there is true, right? Let's say your overhead, part of your indirect cost is your rent, and you've been paying $600 a month in rent for 5 years, and now the rent's gone up and you're paying $800. You're going to have to know that, right? Because otherwise it's going to take away money, and you're going to be spending that money on that rent, and you're not going to have it in your grant budget. So that's going to be bad. Okay. So you really want to understand the concept of relevant range is saying, here's what I know about my budget right now. And when there's changes to it, you're going to be outside that relevant range. And when you make that change, then you're going to be in trouble. So be very careful that, like I said, you're checking. Don't just make this to where it's a habit. You just submit that form again and you haven't made any changes. You haven't looked at, is your cost allocation rate changing? Is the amount of indirect costs changing? When you're filling out that form, have you talked to your financial specialist, right? So lots of information for today, lots of things that you need to check on. Again, one of the few things that I'm going to put this up here as your actual homework. Again, I can't check this. But if you're using your own budget, using the things that we did today, right? Do we get something out of today that we could have that was useful for us? What kind of budget do you have? Is it operating? Is it revenue? Is it expense? When you're talking about this budget, is this your total program budget, or are you looking only at the grant budget? Are there things that are separate from that? When you get ready to do your budget narrative, are you going to put all these things in there because it's your total project? Or do you just need to pull out what the grant's going to actually pay for when you're talking about your budget narrative and that? So have you identified the costs that are associated with your program for the year, especially those indirects? How are you doing that? How are those being billed to you? What does that look like? So can you identify the direct and indirect costs in your own expense account, right? Do you have any in-kind contributions? Could you have any in-kind contributions? Are you using some form of cost pools, cost drivers, and are you being charged properly for those things, right? So a good time to take just a glance over in the next couple of days of your actual budget. See if you can't set up a time. If you're not seeing that financial specialist, can you do so on a regular basis? Can you start to do so to make sure that whatever you're spending is what you should be spending? Okay. All right. It looks like we've hit that 10 o'clock hour on the nose. So we will start with, I will ask you if any of you have done this homework assignment, and then we will go over that worksheet that I just gave you.
Excellent. Thank you so much, Tricia.
All right.
Go ahead.
No, you go ahead. I was just going to say, I hope to see you all on Thursday.
Yes, I was just going to remind everybody, I think we had the wrong date on there. So the date actually is Thursday, the 15th from 9 to 11 again. And we just emailed the link out to you. So please look for that in your inbox. So I hope you all learned as much as I did today. This was very informative. And so we appreciate all of this information, Tricia. Thank you. And if you have any questions, go ahead, feel free to email us or pop something in the chat real quick. Other than that, I think we're ready to roll. Thank you, everyone. Excellent. Thank you, Tricia. Everything is ready for Thursday. So polls are prepared. I'm sorry about that this morning.
No, it's okay. Not a problem. That was actually an easy one for me to just ask. So it's okay.
Okay, excellent.
All right.
Right. If you need anything, please just email me.
All right. Thanks.
Yep. Thank you.
Bye.